Hi everybody, Dr. Daniel. Today I'm talking about the uses of amitriptyline. Now pretty much everybody knows that amitriptyline has been used for the treatment of prevention of migraine for years, and some people have used it for sleep. But here I'm talking about the off-label use of the drug for treating a large number of psychiatric and neurologic conditions. So amitriptyline is a tricyclic antidepressant approved by the FDA to treat depression in adults. And although the FDA approved amitriptyline to treat depression, it has many other types of uses in medicine. And so what are these uses? I'm just going to list them. Chronic pain syndromes, anxiety, insomnia, nerve pain, polyneuropathy, herpetic neuralgia, trigeminal neuralgia, irritable bowel syndrome, eating disorders, and pelvic pain. Well, how does amitriptyline work? Amitriptyline works on the basis of two neurochemicals, serotonin and noradrenaline. Serotonin is called the happy hormone because it modulates well-being and a feeling of happiness. It affects mood, digestion, and daily appetite for food. Serotonin is also a precursor for melatonin and helps control the biologic cycle for sleeping and wakefulness. Noradrenaline is a neurotransmitter secreted in the brain and spinal cord, which increases alertness, arousal, and attention. It causes vasoconstriction of blood vessels and regulates blood pressure in times of stress. How long does it take amitriptyline to work? Amitriptyline used to be taken about 2 to 4 weeks to produce adequate results. It should be taken chronically and given at bedtime to help with sleep, period. It's definitely not an acute therapy drug you take once for a given medical problem. Okay, I'm going to list the different syndromes here and talk about them. Chronic pain syndrome. Well, go to medical school, get a license, and start seeing patients, and there will be some who come in and complain of chronic pain somewhere in their body that often has been previously evaluated by another doctor with negative results. The pain is commonly in their back or their neck or their head or in their abdomen. Many of these persons may be taking opiate narcotics, which is rarely a good option for their future health. Often they also don't sleep well and have low energy. The doctor should try to get them off the narcotics, and amitriptyline in this situation and in low dose, like 10 to 20 milligrams, may provide some help. Anxiety, properly called generalized anxiety disorder, or GAD. Unfortunately, this is a very common human condition. GAD affects 6.8 million adults, or 3.1% of the U.S. population, yet only 43.2% are receiving treatment. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, so-called DSM-5, generalized anxiety disorder is defined as the patient complains of symptoms of excessive anxiety and worry about a variety of topics, events, or activities. The worry could be about employment or the patient's own or a family member's health. The worry is difficult to control and not related to a threat or prevalent risk. Patients with GAD spend a lot of their daytime worrying about something. The patient's anxiety and worry come with at least 3 of the following symptoms, and the symptoms occur for more days than not during the past 6 months. And these symptoms cause significant distress or social impairment. So the patient has at least 3 ancillary symptoms, which are restlessness or mental tension, fatigability, easy tiring, poor concentration, as if the mind goes blank, irritability, increased muscle tension and soreness in the neck, shoulders, jaw, or teeth, grinding, or bruxism. Trouble sleeping, which may come with difficulty falling asleep, maintaining sleep, night restlessness, or unsatisfying sleep. Insomnia. Trouble sleeping is part of the diagnostic makeup of both generalized anxiety disorder and depression. Well, what about nerve pain, polyneuropathy, or herpetic or trigeminal neuralgia? The peripheral sensory nerves are particularly involved with causing pain, which could be from the median nerve of the wrist with carpal tunnel syndrome, or the fifth cranial nerve with trigeminal neuralgia, or the seventh cranial nerve of the face with post-herpetic neuralgia. Neuralgia is a pain along the course of a nerve, especially in the head or face. It may come with a heat sensation or sharp lancet. It may be associated with a numb or tingling sensation. IBS, or irritable bowel syndrome. The diarrhea that comes with IBS may be helped with amitriptyline, which decreases gastrointestinal motility. Amitriptyline inhibits the activity of neurons that control the intestines, and this may help reduce pain. A recent study, published in The Lancet in 2023, showed that the patients taking amitriptyline were most twice as likely to report an overall improvement in symptoms as those taking a placebo. Eating disorders. In general, antidepressant treatment of anorexia nervosa has been given dismal results, although one study of patients with both bulimia and anorexia nervosa found amitriptyline to be better than placebo. Pelvic pain. This could be pelvic sensitivity, painful pelvic muscles, or painful vulvar skin. And a general statement here. Although not an analgesic and not addictive, amitriptyline may help improve painful conditions. And it's not a hypnotic or sedative nor a class 4 addictive drug like benzodiazepine drugs, but it also may help sleep. So God bless all folks who have these conditions. Please click on like and subscribe down there. Make a comment if you wish, and I'll see you again on the next talk. Thanks for listening.